This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about the difference between an X-ray and a CT scan, also called a CAT scan, for musculoskeletal issues. If you like this video, we put out new content weekly, so please like and subscribe. So X-ray and a CT scan. X-ray, we're all kind of familiar with X-rays. You know, they go and basically take a single image. It shows the bones and not a whole lot else. And then a CT scan, which is basically a lot of X-rays taken when you have to go inside a tube, and they take them all at once and they make them into a 3D image. So let's start with X-ray. So when you get an X-ray, usually it's a pretty simple thing. It's less expensive than a CT scan. There's usually an X-ray machine. You stand still, and they'll put some cassettes behind you on certain times, and then they'll snap an image and they'll show just one image. It just shows where, usually if you take it of an extremity, since we're talking about musculoskeletal issues, the bones will be white and anything that's not bones will be darker. Really, the only thing you can really see in X-rays are bones. You can see a little bit of soft tissues, really not great, just kind of the general outline of the soft tissues. We say we can see cartilage. We really can't see cartilage, but we can see the space between the bones. So if there's a lot of space between the bones, we know that there's cartilage there, and if it's not, we know the cartilage is gone. Now, people get X-rays for like their chest and they're looking at lungs and heart. I'm just focusing on basically X-rays of your limbs or your pelvis or your spine. But that's basically what an X-ray shows. Most of the time when you get it for your arm or your leg, it's just three images. You usually get a front view. You always want to get a side view, because if you don't, you'll miss things. And sometimes you'll get a view, an oblique view on the side. A CT scan requires a much bigger machine, and it looks like a donut. It looks like an MRI machine, but it's not an MRI machine. Again, it kind of puts you into the machine. It takes a rapid amount of X-rays, much higher radiation, by the way, then generates a 3D image. Now, again, if you can get them for all sorts of soft tissue things. It can show organs and that sort of thing, but for musculoskeletal purposes, it can show soft tissues a little bit better than X-ray, but again, not the best modality for soft tissues. That's more MRI or an ultrasound. But it will show the bone in much greater detail. So if there's a fracture where you're not sure if it's there or not, a CT scan might show it. Let's say you break your heel bone and it's busted up into a ton of different pieces. A CT scan will show exactly how it's injured. And then sometimes people will get CT scans as well. If, let's say, you have a fracture and they put a plate or screws across it and it's questionable whether it's healing or not, then you'll get a CT scan to see whether it's actually there or not. You can also see if hardware like screws in your spine are loosening or whatnot. But yeah, that's generally, you would do that after X-ray. If you get an X-ray, you don't always need a CT scan. If you get a CT scan, you normally don't need an X-ray. But that's kind of how they're used. But by and large, most people get X-rays, and then some people get CT scans. If you're injured in an auto accident, you go to the ER, sometimes they'll like CT scan your whole body. They're usually not doing MRIs in the ER unless it's a specific issue. Most of the time, it's always CT scans. So again, quick summary. X-ray, just one image. They take like one time, and they'll take a few of them. It just shows the bones mostly. CT scans also shows the bones, a little bit more soft tissues, and it shows things in much greater detail. And that's when you actually have to go on like it's like a big machine, and you kind of go in and out of this donut. So I hope I was able to answer your questions about the difference between an X-ray and a CT scan for musculoskeletal issues. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any specific medical advice about your condition, because this video and all my videos are for educational purposes only. Thanks for watching.